to all of you joining us tonight or today or in the morning, or to everybody that's joining us all over the world. Welcome to the next episode of Veterinary Ramblings. So, start the show after we've started rambling.
We've rambled for about half an hour already, folks. We're well into it.
Yeah, you can bless your cotton socks and feel really grateful that the production team have cut it all. So you just join us at this point in time. So I'll raise a glass to our production team. Thank you very much indeed, on behalf of all of our listeners, having not had to put up with the previous half an hour. Hi, I'm Mike Brampton.
And my name is Julian Ho.
Welcome to Veterinary Ramblings. So, we've got a guest tonight.
Yeah. Really excited about tonight's guest. I know I'm always excited about our guests because they're always brilliant. But here's a guest who has literally come back from the grave just to be on Veterinary Ramblings.
Indeed. This particular guest was due to be starring and recording stuff for you all. I think it was probably about 10 weeks ago. And we'd got it all set up and everything was ready to go. And they just disappeared off the scene completely. We
thought it was something we'd said.
Well, I was sure it was something you'd said.
Usually is.
Usually would be. But we will ask her more about this.
We shall indeed.
A lady who particularly likes fast cars.
And old men.
No, old things.
Old things. That's
old
right.
Things. Old things. I don't think she likes old men. I mean,
I put my special shirt on and everything.
Well, I can see that, but never mind. Yeah, and lovely flowery shirt, lots of bright colours. No,
and I'm wearing my rabbit skin underpants because she likes that, doesn't she?
I don't think Jo would be very keen on that because.
Hold on, I'll look at her bio.
Yeah, Jo is particularly into animal welfare.
She's a vegan, absolutely.
She's a vegan. She's into animal welfare. She has strong interests in rabbits. And in fact, it was that's how I first met her. I'd known about Jo for a long time. But she invited me to speak at the Advanced Rabbit Anesthesia Conference. I did a couple of experiments, including one on Dead Space live to illustrate the importance of dead space. And what I did was nearly kill my volunteer live on stage, demonstrating the importance and the significance of dead space. We'll ask her about that maybe in a minute.
We shall.
I can see she's in the waiting room.
It's Jo Hind.
It is indeed Jo Hind.
Let's get her in.
Ex-president of the BVNA.
Indeed.
So, let's get her in. And here's Jo.
Here's Jo.
Hiya, Jo. How you doing?
I'm good, thank you. You?
Excellent. Thank you very much indeed. Julian and I were just rambling on as we are wont to do. And
we do that.
Surely not.
He said that you were into old men, and I corrected him and said you're into old things. That's the Goodwood Festival of Speed and antiques and stuff that you particularly enjoy, is it not?
Yeah, absolutely. It's fast cars is the thing. You may say fast men, but I'm yet to catch any. But yeah, fast cars. So the Goodwood Festival of Speed is a bit of a passion of mine. I do enjoy going to that and seeing that. So.
Are you a member?
I'm not a member. I was actually on the waiting list to be a member for 4 years to join the GRRC, the Goodwood Road Racing Club or whatever.
Absolutely.
It is. And then it came through at a very inopportune time that I made it to the top of the list when I could no longer play that game anymore. So unfortunately, not a member. But never mind. One can hope. Maybe
I'm a member. I'll sneak you in sometime.
Oh, well, you would be, wouldn't you? It's not what you know, it's who you know.
Absolutely.
Are you really a member?
Yeah.
For our American viewers and listeners, the Goodwood Festival of Speed there's an aerodrome with a motor racing circuit running around the outside of it, and good old stately home, Goodwood House, in the grounds. And every year they put on they do two main events, don't they?
Well, they do two huge ones. There's the revival, where you have to get dressed up in ludicrously old clothes. So I just get whatever's at the back of the wardrobe. My 1930s collection.
Yeah, and then there's the Festival of Speed, which is more of a more of a racing environment, is it not, Joe?
It is, yeah. So they have a lot of different paddocks. It is a very unique event, actually, because there's very few red ropes and barriers. So usually you can get right up close to all of the cars. There's F1 cars, there's motorbikes, there's old things, new things. There's brand new supercar paddock is where I hang out. That's my favorite is in over there. And all the drivers and a lot of the owners as well. And it's a real kind of hands-on event, and there's an auction in the house as well, which is really nice to attend the auction and see some real prize pieces going up for sale. So it's,
and you've got to be very careful to fold your arms.
Yes, absolutely.
Like and don't go.
So
don't have a scratch.
Have you got your sights set on taking over from Supercar Blondie?
Oh my goodness! I mean, as if I could fill those shoes. I don't have the dimensions, shall we say, to fit that role.
What's your favourite car? If someone were to say, "Look, here's a supercar,"
Nissan GTR Nismo edition. That is my favourite.
Oh right.
Which I believe may be is it Jeremy Clarkson's or the Hamsters?
Oh, I don't know actually. I don't know. I can't imagine it would be Clarkson's, but he's not that keen on Japanese, is he? But
do you know? I think oddly enough, it's James May's favourite.
Oh,
Captain Slow.
There goes my street cred. Oh, thanks, Julian. Right, we're done with this now, aren't we?
Have you driven one?
No, not yet. Sat in a few, but not driven one. I'm late to driving, actually. I've only been driving 6 years.
Right.
So, yeah, I've always been chauffeured, which has been lovely, and I've not had to drive.
Very nice. My absolute favourite would be an E-Type Jag. Now, they're not as fast.
Classy.
They're buggers to start sometimes, so I've heard. But I drove one once around Goodwood. One of those driving experiences.
Yeah.
And it was absolutely amazing. Absolutely incredible.
Super. And the noise from them, I think it's like this revolution of electric vehicles. I mean, we need it. I'm a big fan of it for the environment. However, it's such a loss to lose those engine notes. And it's not the same when it's piped in as music. It's and you can pick which, if you drive a Tesla and you can pick which engine notes you want, and you think that there's just
really?
Well, yeah.
You can get it to sound like a Robin Reliant if you want.
Awesome.
Yeah.
I didn't realise that.
Yeah,
all you need to do, Mike, is you just need to put a CD in your car and you can play. You can have whatever you want.
It's a far cry from my.
Does the engine note change as you speed up and slow down? Does it actually?
Yeah. It's supposedly completely recreate. It's just mapping it really, and you pick which car you want to sound like. So yeah. Well, not you personally. Obviously, you don't sit there going.
well, I do. No, I don't. But what I used to do, I used to have a 2CV. So this is way ago. 2CV, and I drive it to college up in Potter's Bar. I drive up on the Monday morning and drive down on the Friday night on the M25. And the thing about a 2CV is that they're brilliant cars, absolutely amazing gearboxes, but they're not very robust. You can't lock them properly. So, or at least I couldn't lock mine. So I didn't have a stereo because I had a stereo and I bought it and it got nicked. And I got another one and it got nicked that night. So I thought after that, I'm not going to bother with a stereo. So what I did was I had one of those harmonica holders and I stuck it around my neck. Okay. So I could play the harmonica while I was driving along. See, fair enough. And it was all okay until I was driving back on the M25 one night, much like tonight where it's peeing down. And my windscreen wiper often didn't work. So I was perched on the very front of my seat, holding the steering wheel, leaning out of the window with my squeegee, wiping the windscreen, and playing a little song on the harmonica. And I suddenly noticed this sort of flashing light in my lateral vision. I looked over, and there was this policeman matching my speed. He was going very, very slowly on the M25. And he just looked at me and went,
"Oh dear."
Pulled me over. He said, I have no words for how stupid that is, sir. Just promise me you'll leave the M25 now and never, ever get on against this.
See, that's why you've always got to keep emergency string, because you can tie the string on the wipers and just do this, and then from inside the car.
I should have done.
You need a nurse's brain.
Yeah.
I have been in a car and had to do that. Luckily, I was only the passenger, not the driver. But yeah, it was a thing. The joys of Alfa Romeos that definitely don't like the UK and definitely don't like the rain.
They love rust.
They do love rust. Yeah.
I think we've pretty much done cars to death, haven't we? Bearing in mind it's veterinary ramblings, not motor ramblings. I apologise for that.
We have already, on numerous occasions, been compared to the Top Gear boys.
Oh, I'm not going to say who is who. I'm not going to go there.
We're twins separated at birth. We're the same.
Yeah, it's not the current Top Gear guys either.
So you're into rabbits in a bit of a way, aren't you, Joe?
I am rather keen on a bunny or two. Absolutely, yes. It's been a passion of mine my entire life. Really, I had them as a small child. Thought it was wrong as a very small child. Why is it kept in this tiny hutch? So Dad diligently went and made a non-small hutch for it to live in this kind of, castle, and we did the best we could. And obviously we fed it muesli food and did all the things that you're not supposed to. And there wasn't vaccinations and neuterings and things back then, but life evolves, and yeah, so there's always been a passion for rabbits. And when I got into the veterinary side of things, because again, I always wanted to be a veterinary nurse, but when I left college, I couldn't afford to take minimum wage. I needed some extra money to help the family out. And so I went into my more normal work and did some other bits and pieces and some diversifications. And when I finally could afford to get into veterinary, nobody wanted to do rabbits because they just died and everyone was scared of them. I thought, that's the species for me. So yeah, that's how that came about, and tried to champion them ever since, really.
I was explaining to Julian how we first met, and that you very kindly asked me to speak at the anaesthesia conference for you, and how I nearly killed my volunteer doing a live dead space experiment.
Brilliant. I mean, absolutely brilliant. If only we had it on video.
Got the point across that too much dead space can be dangerous.
Absolutely. Too much dead space can lead to dead. Yeah,
absolutely. Yeah. You say you championed the cause of rabbits, and I think you really have. And you've been to some extent recognised for that, haven't you? You were awarded the Blue Cross Veterinary Nurse of the Year in 2014.
Yeah,
very, very high accolade. The RCVS Innovation Award in 2017, and the same year the I4 Animal Advocate Award. So, congratulations, Joe! Really, really well deserved. And what a feather in the cap for veterinary nursing generally, and for you particularly.
What are you drinking tonight, then, Joe?
I have very exciting cherry cordial and soda water. So sadly, ill health has meant less bubbles in my life, which is really not a good thing. Yes, I'm on the softs, but no, the awards. It still doesn't kind of feel right. I just feel like I'm doing my job and living my life, and just trying to raise standards of welfare through education. Really, that's kind of my thing. And I think when you are in a position where you can reach more people, so being a veterinary nurse, for example, you get to speak to a lot of owners. I do think we have a duty, certainly a moral duty at least, to impart as much education and wisdom as we possibly can. And it's not about trying to make people mini vets or trying to make owners self-sufficient without vets. It's just if we empower them with the tools that we've got to try and help understand, do body condition scoring and understand how to do weight clinics at home in conjunction with your weight nurse, we are effectively building communication, building trust with our clients. And then we're seeing these animals in a better condition. They're not going as far. So we can help more just by spreading a bit of information. And it's not releasing trade secrets and all these sorts of things. It's just, sharing the information and just really helping. So
absolutely, because believe it or not, vets and nurses actually want pets to be healthy.
I know, revelationary.
Who knew? It's not thinking, oh no, if they do this, they won't get ill, we won't make any money. We love healthy animals.
Absolutely. And that's why we do our job. We want them to be healthy. That's why we're so keen on preventative medicine. And certainly in my rabbit world, we're so keen on husbandry, because that really is the cornerstone to health. So pushing through with that, and that's not just owner education, that's trying to change government and legislation and what can be sold and what can't be sold, and minimum sizes for enclosures, and all these different things are all part of this jigsaw that kind of need to be tackled to improve the awareness, and by doing that we improve the welfare.
There was quite a campaign last year, wasn't there, on hutch size and companionship?
Yes, yeah.
Yeah.
Absolutely. And as the BVNA, we were very happy to sign up to that joint statement with the BVA with regards to companionship in rabbits and how important it is. And we are, if we look back even over the last 10 years, rabbit health has really come on leaps and bounds, or hops, should we say. But it really has. Yeah, I know. Too much time with Mike.
I'm sorry, Julian does the jokes.
Oh. Yeah, it really has, come on well. And when you think back 10 years ago and we were talking about muesli mix and how rabbits should eat a pellet, not a muesli, and rabbits should eat hay, and and now we're having conversations about urinary issues and bladder sludge as commonplace first things that owners are saying on forums. So we really have come a long way. There's a lot of work still to do, but we're definitely coming a long way. And the PDSA PAW report is testament to that as well, and something I'm very, very keen advocate of. And the results of the most recent trending, because they're coming up to their 10-year anniversary of the PAW report, and some really good stats in there as well, looking at how things are getting better, but there's still work to do.
What are the key points that we should be looking at to improve rabbit welfare in?
I think it's as I say, multifaceted. So I think even though we work in the veterinary sphere, I think we need to look at the owner. I nearly said owner penetration then. That is not what I meant.
That's a different sort of rabbit, actually, isn't it, Joe?
Absolutely.
Yes, that's
whole different sponsor.
Yeah.
Yes, we need to look at owner engagement as well as what we do within clinic and outside of clinic. So I think, again, husbandry really is so important, and getting that right. And so we need pre-purchase appointments, which it's a devil's own job to try and get pre-purchase appointments for a prized item such as a cat and a dog, let alone rabbits that often are picked up on a whim. So I think we need to do a lot of education there. We have a big problem. Well, problem, actually. I'm going to stick by that within the veterinary field, that we're not taught enough about rabbits as we train as vets and nurses. We generally, depending which university you go to, we have very little training, rabbit specific training, but they're the third most popular pet in the UK.
Well, I agree. I qualified 24 years ago. We had, in my training, we had 1 day on rabbit medicine in the 5-year course. And you're expected then from day one graduation to be able to treat them adequately. I have to say, I've been on many courses since then, and read around the subjects and gained a lot of experience, but I will still be happy to refer rabbits for more complex procedures onto specialists. And I think that's a very underutilized tool in the veterinary field as well, isn't it? That the acknowledgement that rabbits have specialist nurses, specialist vets, because they have specialities.
Yes, very much so. And I mean, the main thing is they're a prey species, not a predator. And we're used to dealing with predators. And we're taught in general how to deal with predators, apart from if you're talking about large animals and, hoof stock and things. But, our whole body language, our whole way of working, everything needs to change for these prey species. And yeah, we just don't talk enough. We don't communicate enough. And I find in the exotics world, we're a lot happier to share our opinions, and I can pick up the phone and I can speak to a rabbit specialist like this, and vice versa. They, a normal clinician, run-of-the-mill GP clinician can go through referrals, or there are some, there's some tame exotics vets out there that are more than happy to take emails and calls about, oh my God, I've got this, what do I do? And I think we're better at doing that in the exotic side of things than we are in the mainstream cats and dogs, really. Right. But I think I'd like to see more veterinary teams do that. I'd like to see them open a book more. Be honest to the client and say, actually, do you know what? I don't know. I really don't know. However, I will find out for you. And that can be within a matter of minutes, or that could be a matter of weeks. But either way, just be honest with the client and go, do you know what? I'm happy to see Flopsy, but it's not my area of expertise. I can give pain relief. I can give the emergency treatment that we need to get you through whilst I get information from another colleague. And also, so I'm a nurse. I'm not allowed to diagnose. However, I have a lot of rabbit knowledge. I teach all sorts of rabbit things, including surgeries that I'm not allowed to actually do myself, but I teach vets how to do them, or students how to do them. And I think we need to remember that team cohesiveness and go, actually, there may be someone on that team that is a nutrition specialist, or we're not allowed to be a specialist, a nutrition expert, or a rabbit expert, or diabetes expert. And again, use that whole team and go, okay, I might be the vet, but actually let's have a clinical discussion about this and see the best thing we can do for our patient.
Yeah.
Absolutely.
You own and run a company called Lego Learn, don't you, Jo?
I do indeed.
What was the motivation behind Lego Learn? And what are you aiming to achieve with it?
So Lego Learn was twofold. One, as I said, I always wanted to be a veterinary nurse.
Right.
Got my dream, struggled through my training, had an awful training practice, a terrible clinical coach, had some health. I had a motorbike accident during that, so I was in a wheelchair with a busted up leg for some of it. So it was a real slog trying to get through my training. Got through my training, brilliant. Few years into that, going on a home euthanasia visit of a 32 kilo Labrador, and vet refuses to help me lift said dead dog back to the car. Going through the house as nicely as you can, pop goes a disc in my spine. Roll on 12 years now, or something like that, and I've had 4 spinal operations and still waiting for a final one to fuse 3 of my vertebrae. And so basically at one point I woke up in the morning and I was paralyzed from the waist down because I'd gone into full-on cauda equina. So that was a bit of a wake-up call, and no more bending or lifting thus forth. So that does not make for a very good or useful veterinary nurse. So what the bloody hell do I do? I've just got, the job I want. So I thought, right, let's diversify. I'm not going to give up, because I'm not one for giving up. And I thought, what can I do? I thought, well, those that can do, those that can't teach. So I'll go and teach. That's what I'll do. And so obviously my wheelhouse is rabbits. I found a tame vet that was willing to come into it with me. And I work with Ivan Krotas, who isn't a certified specialist. However, he has a wealth of rabbit knowledge. And we talked together internationally on a few different lectures and things. And we just come up one day and we said, what are we doing? Let's do this together and let's make it a thing. So thus Lego Learn was born. And basically we do teach, or until the Rona came to town, we do teach face-to-face globally around the world. And its aim is just to bring up-to-date, factual and useful rabbit medicine tips, and surgical tips to veterinary staff, anyone that wants to learn. So if you work on reception, You can come to a surgery course. We don't care, because we see the importance of everybody understanding what's going on. So, for example, and another reason for taking that stance is, as a nurse, there were many large organisation CPD events that I wished to attend that I was not allowed to attend because I was not a vet. And I said, well, can I pay it and just stay to the side and not do the practicals? No, you can't. Whereas in my mind, if a nurse is allowed to learn what's going on with that surgery, then that nurse is going to know where the potential points are for increased analgesia is going to be needed. Even though they're not doing the wobbly bit surgery themselves, everybody understands a bit more what's going on. So I think there's value, and if you want to learn, we'll teach you. So
you're absolutely right. And I'm involved with the BSAVA, as I've mentioned a lot of times before, as you know, Joe, and we're trying to put together the program for the Congress 2021, which is going to be virtual, and we've very much taken the decision that all lectures should be team appropriate. They're not really, these are vet lectures, these are nurse lectures, these are team appropriate. And there's a huge amount, as you say, of crossover, cross-training almost. The vet could do an absolutely brilliant job of surgery on a dead rabbit because he hasn't spotted the signs that he could have used to alert the nurse to deterioration.
Yeah,
similarly, the nurse could do an absolutely fantastic job of monitoring an anaesthetic, but not appropriate perhaps to that surgery. So there's got to be an integrative approach.
Very much so. And one of the things that we've been doing is LegoLearn is we teach together. So Ivan and I will often teach together, and we've moved that through because we're sponsored by Supreme Pet Foods, and we've moved that through to lectures as well. So at BSAVA twice now, I think we've done what we term an It Takes Two lecture, and it's usually Molly Varga and myself, and we had one today actually that sadly I've not been well enough to do. I was due to do with Molly, but her nurse Craig stepped in and did it today, and they did an amazing job. Yeah, so it's the It Takes Two, and basically you have the nurse and the vet presenting at the same time on the front of the screen. So you go through rabbit dentistry or stasis or whatever the case may be, and you do both things together. So the vet says their bit, the nurse says their bit, and again it just brings this cohesiveness of actually how you do need to have clinical discussions. It's not just this one person does this and someone else does that, and it's good to learn as well. And I had this for a few years now. I've run a lecture on holistic anesthesia, and I've done it in multiple places around the world, which has been amazing. However, if I was to call the course husbandry or the talk husbandry, I'd just get nurses. And when I changed it to holistic anesthesia, then I got vets attending. And I got vets attending and telling me multiple times, do you know what? This is all stuff that I never knew. I don't want to know, but I need to know. And thank you, because actually it's very beneficial moving forward. And I think that's another thing. We've got to remember that we do need to be clever with our marketing as well. So as much as we can offer these things, we've got to be clever and entice stubborn vets and stubborn nurses and stubborn, ANAs and receptionists in to try and learn stuff that they don't think they need to know, and they maybe don't want to know, but it's actually really important to the whole thing.
I like that. That's really nice. Cheers, everyone.
Oh, cheers, Julian. Cheers.
I'll just sit and have my, cherry aid.
Well, we'll drink for you. We'll drink for you, Joe.
Thanks. That has been done before, so yeah.
You're very welcome. You mentioned that you crashed out on a lecture today because you wanted to appear with us this evening. Thank you very much.
Absolutely.
I was saying in the introduction how we'd got you booked. It seems like a lifetime ago, and you were just about ready to join us on the show and do a recording, and then you just disappeared.
Yes, poof, just like bad magic. Yes.
It seemed like, and it took several weeks before I was able to catch up with you and to find out that you were actually seriously ill in hospital.
Yes, it's been emotional, as one film would say. It's been a real roller coaster, actually. I had a very, very simple procedure to have a contraceptive coil put in. I'm really oversharing, but there we go. And I was one of the 1 in 1,500, I think, that it perforated my uterus. And it's a known side effect, but very, very rare. And things just spiraled and got worse and worse. So the Clip Notes version is that I ended up with pelvic infection, which went to peritonitis, which led to, I had a pneumococcal infection in my bladder. I had silent pneumonia. 2 of my lower lung lobes collapsed. I had to have emergency surgery because we didn't know what was going to kill me first, the sepsis or the actual operation to kind of take the pus out of my abdomen. So I was starved for 3 days while my chances of survival went from 30% to 40% to 50%. We went, right, 50%, we'll do this. We'll give it a go. They took 800 mils of pus out of my abdomen and stitched me back up, sent me back upstairs, and then I went into septic shock. And so tried to die again, which is rather rude, 3 times in total. My body decided it had enough, and I'm just too stubborn and held on. And it all resulted, it ended with me being on multiple drugs. I mean, I was on 4 different types of IV antibiotics plus oral antibiotics. Some days I was taking 28 tablets 3 times a day, as well as IV medicines. Exceptionally poorly, and ended up in a psychotic episode break for 3 days as well. So the sepsis was trying to get to my brain, and my body had 2 choices. It could either go into a coma, or it could go into a psychotic break and have lots of audio and visual hallucinations. And unfortunately, it chose the psychotic break, which I would have actually chosen the coma over, because it was the most horrific thing I've ever had in my life. I've never been so scared in all of my life. Part of my psychosis was that people were trying to kill me, and the doctors and nurses were trying to kill me as well. So in that setting, that can then be very difficult to trust anybody.
Yes.
All of this happened whilst I was on holiday down in lovely Dartmouth. So I was taken to Torbay Hospital, where the staff were amazing. But again, due to the Rona being in town, no visits. And my family all had to leave 5 days later as well, because we'd only had kind of a week's holiday booked. So I was all on my lonesome for 3 weeks in the hospital. So yeah, it's been quite horrific. I've been exceptionally poorly. I'm still exceptionally poorly, even though I won't actually accept that I'm exceptionally poorly. And I'm suffering from a lot of complications and side effects from the sepsis and the operation. So part of that is I have quite a lot of gastric ulcers and gastritis and colitis. So that makes eating and moving generally exceptionally painful. And limited pain relief as well. I do not have multimodal analgesia. I mean, where is my lidocaine CRI? God damn
it. Gosh.
So yeah, and it's a long recovery as well. So we're looking at least 6 months, and it can be years for some of these things to.
Can I ask, because I've come across I knew virtually nothing about sepsis, and it comes up quite often in respiratory physiology, and a lot of work is done in ventilation and ventilator parameters for life support for patients with sepsis. But I've always taken that from the research. Sepsis, yeah, this is where it's useful, and this is where we need to know, and we need to know how to support lung tissue and support the thing. But I've always viewed it as a ventilatory respiratory thing, and the sepsis is sort of tagged on at the side. And that was my knowledge of sepsis and my exposure to it. What about you, Julian? I mean, what was...
we were told simply at college sepsis or septicemia, leading to septicemic or septotoxemic shock, was either a primary event where you get a bug going directly into the bloodstream, or more usually a secondary event, a complication of an infection elsewhere that travels to the bloodstream. And this is 24 years ago, as I said, when I studied, and we were told, I'm afraid really there's not a lot you can do for sepsis, because from sepsis you get disseminated intravascular coagulation, DIC, and
death is coming.
And the joke was then it was called Death is Coming, DIC, Death is Coming, because once you got that, nothing you can do. There must be something. You could try streptokinase, or you could try Stegantox. Do you remember Stegantox, Joe? Were you? No, you're not old. You're not old enough
one
to
for me, I'm afraid.
I'm
there with the halothane, but I'm not quite there.
So Stegantox was a mix of antibodies raised against I think 12 or so of the common suspects, the usual suspects in toxemia.
Wow.
Because it's not necessarily the bacteria, but it's the toxins the bacteria produce that cause the problems. And so you give them an injection of the antibodies against these toxins, and they're fine again. They're not in practice, because what happens is you've got a decreased renal perfusion, and you get glomerulonephritis quite rapidly due to these antibody antigen complex formations within the bloodstream. So Stegantox was eventually taken off for those reasons, and for the fact it didn't seem to do much good. Not a harm, not much good.
So was this similar for you, Joe, before you actually contracted?
Yeah, I always thought sepsis and septicemia were the same thing. And basically I thought it was blood poisoning, and septicemia is blood poisoning. Septicemia is sepsis is not.
Yeah.
So the clinical definition, I've since learned from the UK Sepsis Trust, who are quite an amazing resource. I've since learned from them that there are red flags, and basically you have 2 or more concurrent infections plus one organ that is starting to fail, and then you are clinically considered to have sepsis, and that can then spiral up. You can have 3, 4, 5 concurrent infections and multiple organ failures.
Absolutely, but it has to fulfill those 3 basic criteria first, and called sepsis. So
absolutely, and it's
septotoxemic shock, I think is the the other names. And the problem then is, the big problem, of course, is that it leads to failure of organs, and so
and you've got a golden hour, which mine unfortunately was missed. I wasn't when the ambulance arrived to come and collect me, because as you do as veterinary professional, you think, well, I can't be that bad. They told me to expect some like a bad period pain, so there's me in agony, and but thinking, well, it can't be that bad. I'm not going to waste anybody's time. And the ambulance crew turn up and say you're 2 hours off of a coma, and you go, oh, okay. But I wasn't actually diagnosed with sepsis for the first week, really. So my therapy wasn't started as quickly as it could. But this is that's no detriment to the hospital. That's just a thing with sepsis, and I think we suffer from it in the veterinary field as well. You go looking for that one thing, and because I had a reason to be there, I had this coil implanted, therefore it must be something to do with that and that only. You get blinded by the one thing, when actually, again, it's this multifactorial thing that's going on. So
this slide is from the Sepsis Trust, which is the organisation you've just mentioned there, Joe.
Yes, thank you.
So you're showing a poster there from the UK Sepsis Trust. Do you want to talk us through that poster, Mike?
Me? I don't feel qualified. I mean,
Joe.
I'll give it a go.
We've got somebody here that survived and is still suffering.
Yeah.
It's obviously not it's not a on you're poorly, off you're better thing. This is going to drag on for a long time for Joe.
Yeah, potentially. And I think there's a statistic I read from the Sepsis Trust, because I've done the typical thing of reading lots of information about it, only factual information, not kind of just Dr. Google and chat rooms. But it's really scary stuff. 50% of people never go back to normal after having sepsis, and I'm just thankful I wasn't normal before. So I mean, it should be all right. But yeah, there's long-term cognitive issues, there's long-term muscle issues. For example, lots of people lose limbs. Thankfully, I have all of mine. But it's picking up these signs early, and you can get slightly different sign red flag warnings for children as well. And these posters are perfect, I think, for any workplace to just be aware of, any friends or family, just be aware of, because, and that's why since coming out of hospital, I've shared my story very publicly and quite graphically, very cringe-worthily for me. I'm kind of hiding behind my keyboard as I type this stuff, but just the thought, if I can help one person ask their medical professional, is there any chance this is sepsis? That could save their life or their limb, or so things like having slurred speech. I had all of these things at home, on holiday at the cottage we were at, but just didn't pick up on it. The extreme shivering and muscle pain. I felt like I had really, really bad flu. Flu where you've got that £50 test, that £50 note's on the end of the bed, and you can't even reach to get it because you feel so poorly. No passing of urine, or very reduced passing of urine. And the breathlessness I put down to pain, because my whole abdomen was in severe pain. And of course, that pushes on your diaphragm, and that means you can't breathe well anyway. So again, a little bit of medical knowledge in my brain is going, well, I'm only breathless because I'm in pain and can't be that serious. I personally didn't feel like I might die at that point. After that, I did quite a few times.
So by the sound of it, you went through quite a few days where you felt like you might die.
Yes, there was 3 times when the one of the consultants came to see me on 3 separate occasions and said, do you want to ring your family? Do you want to have those phone calls? Kind of, it might be the last chance to have those phone calls. That's a strange position to be as well, because you kind of, you also want to protect your loved ones. So you do ring them and you do have these conversations, but you don't say, I'm ringing you, it might be the last time I speak to you because, I'm going to theatre, or I see you, or this and this. And you kind of hide things from them to shield them. And mottled skin. I didn't have mottled skin, but I was quite exceptionally pale, but flushed in the face, and blue things. And there's a thing called post-sepsis syndrome, PSS, which I'm officially in. And it is a term. It's not a well-recognized term within doctors. Again, it's something that I'm trying to raise awareness of, that it's not like a broken leg or a heart attack that you just have the treatment and then generally get better. This is something where you do have to change your life for quite some time, possibly the rest of it, to kind of deal with it and get around things. So and that's all really related to the impact that these toxins, this endotoxic state, has on potentially every single organ of your body. Yeah, absolutely, because your body basically attacks itself, and it chews at anything and everything because it's overrun with bacteria and it can't see good from bad. And so every organ gets it. So thankfully, as yet, we don't think I have any kidney damage, which I'm very, very thankful for. And my there is a bit of damage to my lungs. Certainly my right lung was the worst collapsed, and my SpO2 was averaging at 88%, and that was even with supplementation. So I was very close to having to go on a ventilator, but again, too stubborn, and saying, just up the flow rate, we'll be fine.
Don't want the disease of being attached to a ventilator.
Yeah.
Right. I've seen what these people with ventilators do, so...
You don't want to be on a ventilator if you can help it, can you?
No, absolutely not. Absolutely not. So, it's been
I'm so pleased you made it through. I mean, my goodness, what a...
Thank you.
Beautiful thing to happen. And thanks so much for sharing your story with us about that. I know you must have dragged up and continue to drag up horrific memories to do that. But I think, as you say, if listening to this helps just one person, then
absolutely. Just be aware. Just have a look on the website. Have a look at the UK Sepsis Trust. Just see those red flags. And if your child, your mother, your brother, your sister, your friend, your colleague is unwell, and I think certainly in veterinary, we're getting bitten and scratched all the time. This must be an underbelly of sepsis survivors within our own community. And I've had a little bit of a poke around on the social media forums on Facebook, and a few people have come forward and said, yes, I've been through it as well. And I think we're probably one of those. No one knows why a person will go into sepsis or won't. There's no underlying thing. It's not genetic. It's not, there's no reason behind it. However, I think because we are at a greater risk of having our skin injured, then obviously we are at a greater risk of getting infections and getting unwell. And I would be interested to look and see actually how many people have been affected or know someone that's been affected and survived or not, sadly, through sepsis. Because it really is a hidden killer. And I can't remember the exact stats, they're on the website, but I think it's something like sepsis kills in the UK more people per year than a couple of the cancers combined. And you think how much we know about cancer and how much we're aware about that as a problem. And yet this is something that is just silently running around our hospitals.
It's a horrific thing. And as you say, vets and nurses, anyone in the animal profession, we tend to be a bit gung-ho, don't we? Bitten by a cat and you go and wash it. That's all right. That's all right. Stop bleeding.
Bit of iodine and it'll be fine.
Suck the poison out, it's fine.
Absolutely.
But actually, all of these things need to be taken very seriously. Could I ask, and don't answer this if you don't want to, but are you, do you take a stand now against IUDs? Do you see that it wasn't, that the risks were there, but they were tiny? And
no, absolutely not. I don't have an issue against IUDs. I think they have their place in treatments. Mine was purely for contraceptive reasons. A lot of people need them for actual gynae health reasons. I'm just a statistic. I was just unlucky. And that's just the way it goes. Do I wish I'd never gone for it? Absolutely. And in my remedial surgery, did I say, take it out, take it out, take it out? Then yes, it is gone. It's left the building, which I'm very...
That's a different question, isn't it?
Absolutely. But no, I definitely, I would never... I think I'm a bit too pragmatic for that. I'm not the sort of person that's going to scream and shout and say that there's a miscarriage of justice and that these items are not suitable to be on the market, because absolutely that's not the case. We have risks with everything we do, to our bodies, put in them, take out of them. That's just the way that the cookie crumbles. And unfortunately, as I tend to in my life, if I'm going to do something, I'll go ahead and jolly well do it to the best of my ability. And apparently that goes for dying too.
Fair enough. So we're not going to see you campaigning against IUDs outside the Houses of Parliament, waving placards, shouting and screaming.
I do like to badger Parliament, shall we say, but not for against IUDs. No, absolutely not.
But I think we know what the response would be, don't we? You're perfectly at liberty to use these devices if you want. It's up to you, and you can use them. But please, if you do wear an IUD, don't go to work or Barnard Castle unless you want to, and keep everyone safe. Thank you.
Perfect.
Who let him in?
I love wearing the wig. It's great. My head's warm when I wear it.
So I'm going to share a couple more photographs. I'm going to share my screen again here and share a couple more photographs, because you have been known to protest outside the Houses of Parliament, haven't you?
Absolutely. I'm
just showing a photograph here of you holding a placard saying skin test is inconclusive and out of date. not fit for purpose, hashtag wake up DEFRA. And here's a photograph of lots of smartly dressed gentlemen, and you've picked the guy with the bright orange coat on and the shaggy white hair.
Absolutely, that's one of his favourite rat coats. That's that's how he rolls.
So could I just say this is amazing. There's a picture of Joe outside the House of Parliament, somewhere outside the House of Parliament.
Slightly further down, yeah, slightly further down. Yes, Brian May. Bless him. Yeah. I'm a big fan of the Save Me Trust, which Bry set up and runs with Anne Brumner, and pre-BVNA presidency, I took part in quite a lot of evidence-based research and campaigning against the ineffective and failing badger cull. As such, there was lots of parliamentary meetings and protests as well that I attended with with a group of vets and nurses called Vets and Nurses Against the Badger Cull.
This is Mr. Ian McGill here in the background, I think.
Ian McGill lurking in the background, absolutely, who heads it all up. Sadly, presidential duties come first and political views have to be put to one side. However, political views never actually go away. You just have other things to be dealing with. So those that know me know that if I get a bee in a bonnet, and I will be that voice of the voiceless. And however, I do like to think I'm always pragmatic, and it is evidence-based and well researched. I'm not just shouty for shouty's sake. And yes,
say to our American cousins listening in to the show or watching us, at the moment we have this horrific thing going on. There's this sort of middle-aged witch hunt whereby badgers, Britain's largest predator, they're being hunted down, they're being shot to try and curb the spread of bovine tuberculosis. This despite the fact that it's been shown by pretty much every study that culling badgers does not have a long-term effect on reducing bovine tuberculosis. In fact, it increases the range and spread of bovine tuberculosis in most studies. It's barbaric, it's inhumane, and in an era where we're losing so many wonderful animals because we can't keep the fucking planet safe, we are deliberately going out and shooting these wonderful creatures. Mike and I got quite emotional a few months back over this subject, and I think we will again if we're not careful. But please, anyone who's listening and can exert a little bit of pressure, just say it's not working. Stop it. Oh, and Mike's got someone on the phone now. Mike is on the phone.
It's the hotline.
Boris Johnson saying, "Okay, I'll stop it now. I didn't realise there was no evidence. I always contact SAGE to ask them for information. On this occasion alone, they appear to have given me incorrect or out of date information. So I'll very much change that. Thank you for letting me know." So thanks, Boris, for stopping the badger cull.
That was MI5 saying that Veterinary Ramblings beginning to tread very closely to extreme political views that are not held by DEFRA or the UK government.
Absolutely.
Sorry for the phone call. That was the second one they've had this evening.
Absolutely. And the BVNA are putting a big caveat that Joe Hind is not representing their views right now either. So I think the other thing that really frustrates me about the badger cull is the fact that it is just that carrot of shame given to the farmers. These farmers need help, they need assistance, they need guidance, and they need tools that work and things that actually make a difference. And the cull is costing them money, it's costing their livelihoods, and some of them it's costing them their lives. And we as a nation are failing them by using methods that are not going to cure the problem. So as much as it's about the cute, fluffy, endangered creatures, for me also it's the human impact, let alone the herd impact of what they have to go through, but the human impact of how this that this tears their lives apart. And there are better ways, there are other ways, and it's been proven by the Gatcombe Farm project. Do look it up if you're able to, again, through the Save Me Trust and Brian May's work. So yes, Dr. Dick Sibley.
A very good point, very well made that, Joe. In that it's very easy to demonise a whole group of people, like the farmers, and unfortunately a lot of them are not that knowledgeable or skilled in biosecurity, etc. And we tend these days to jump to these extreme views, don't we?
Yeah, very much so. And it's it doesn't help when ideally we need the veterinary factions all to come together and sing the same way, but they're never going to, and so it makes guidance quite difficult. It's a very difficult and politically sensitive topic. However, in my mind anyway, if we look at evidence-based medicine and evidence-based research, then we've got our information there on what can and does work, and really that should be pushed through and upheld for the sake of everybody and everything. But as you say, polarizing views are what the world wants in these modern kind of days. In the last few years, really, it's been more about polarization, I feel, and socialization in general has become more and more polarized, and we've got ourselves into quite a pickle, really, I think. And the lovely veterinary hashtag of be kind just really, just it can actually be that simple. If you just spend your day going, do you know what, I'm not going to be an arse, I'm actually just going to be kind. And you can still have a bad day and rant and rave and kick the washing machine, it doesn't matter. But I'm sure washing machines' lives matter too at some point. But just take that step back and say.
We're not going to say white goods lives matter.
No, we're not going.
No, absolutely.
We're not going to get into that smeg.
No.
We have a challenge for you, Joe.
Goodness.
If you feel up to it.
Go on then.
Is it going to take a minute?
Oh, okie dokie, yeah.
We've got a thing on the show that we call 60-second CPD. This is the challenge. I mean, are you up for that?
Yeah.
Let's get my clock ready. And
maybe like the countdown timer. Do.
Yeah, we'd love
for
to do
legal
that.
reasons, we can't use that one.
Other game shows are available.
Right, okay. Here we go then. We've got the timer ready for 60-second CPD with Joe Hind. What are you going to talk about, Joe?
I'm going to talk about rabbit nutrition.
Rabbit nutrition. Okay, 60 seconds starting now.
Okay, so the cornerstone to good rabbit health is good nutrition, and it's really important you know what that comprises of. So hay is the most important thing, and it's the vital part of their diet. They should eat a ball of hay at least the same size as their body every single day. As well as this, they can have some pellets. They need to be good quality and extruded pellets, and there's only 2 companies on the market at the moment that provide extruded pellets, so look out for those. And they need to be very high in crude fiber, not beneficial fiber, but crude fiber. Adults only need a tablespoon of pellets per kilo of ideal weight per day. And they can also have some fresh herbs and veggies that's no bigger than a small handful, no bigger than the rabbit's own head per day. So everything is about that hay, and alfalfa is not the devil. It has vital calcium in it, so pellets made of alfalfa are fine. They're not going to cause any damage to healthy rabbits.
Wow.
Good.
And we're there.
There we go.
Do you remember when a certain, I won't say the name of the food because I don't want to be sued, but it was a man's name, rabbit.
Yes.
And it's a mix, looks like a lovely little mix of food. And he said, the time we were all told as vets, that's fine, it's a good food, it's a very well-rounded food, but you must make sure they eat the peas and the sweet corn because otherwise, And so we were saying to people, look, is he eating more peas? And oh, definitely. Oh, see, that's maybe. Can you take some of the peas out, but more of the sweet? I'll try it. Yeah. Ridiculous.
It's bizarre. It's bizarre the things we do, but we do it to the best of our knowledge at that time. And
we do, and it's
you
natural
know,
for clients to want to feed something that looks to them nice.
absolutely. And you
You
know,
think, oh, how boring.
yeah. And any veterinary professional knows that owners think their pets get bored with their food, and they don't. We know they don't. They're just happy to have food. But if we've got someone as we can put our floppy ears and our puppy eyes on and get something more yummy, then we're going to push it. And rabbits are no different, and they've got an exceptionally sweet tooth. So yes, they love all the things they shouldn't love. They love.
Absolutely.
But yeah, we have a duty to keep them well. And as I tend to say in my lectures, is if my parents had never fed me cake, I would be thin. So if you've never had it, you don't miss it. And things are always evolving. It was only probably about 5, 6. Oh, actually, I'm probably kidding myself. Probably about 10 years ago now that the hay and greens diet was the way to go, and pellets are the devil and you shouldn't have them. And it's just simply not true. Pellets are a vital part of the food stuff. They are the vitamin supplement. We cannot provide the whole range of nutrients and in the correct quantities and percentages that these rabbits need just through hay and veg alone. Because a wild rabbit has access to the whole supermarket. Our domestic rabbits have access to half an aisle with what we give them. And if we were to try
Nice way of putting it.
And if we were to try, I do love an analogy. If we were to try and to try and give them all of their, I think it's 26 different nutrients that they need, we'd need to know their RDA for that rabbit at that age, at that weight, with whatever comorbidities it's got, and then look at that piece of cabbage and say, right, of those 26 nutrients, what's in there at what percentage? Then we've got to add that to something else and do the maths to work out what they need for that day. Otherwise, we're under or overfeeding. I mean, no one's got time for that, even if we could.
No,
so,
they haven't the time for it. They haven't got the intimate knowledge of RDA for all these things. So,
absolutely.
The tips. So we do the best we can. And I think your encapsulation of that subject in 60 seconds is absolutely incredible. We are well recognized, mainly by just the two of us actually, but we're well recognized as suppliers of good quality CPD, and I think we need a certificate, don't we, for that?
We do. Have you got a certificate, Julian?
Let me have a look. I do actually, just here.
Lovely choice of car there. Look at that, hey?
I believe I'm going to be wrong here, and someone's going to pick me up in it. And I hope they do. I think that's a Jaguar D type, but it's about 1960s, 1950s, 1960s, and that was taken at Goodwood during the Festival of Speed.
Fabulous.
There's a rabbit. There's a rabbit.
It's like a picture of a rabbit there.
Oh, but you failed, Julian. He's on his own.
No, I just phoned in. There were 50 others. He was.
Oh, okay. That's hiding.
Rabbit. That's a wild rabbit.
I know. Yeah. Fabulous. You can see his little cottontail.
And look at it. You'll appreciate this because you said one of your other pleasures is trying to find a decent vegan restaurant.
Ah.
And so I've got a picture here of red onion being chopped up. Because the vegan meal I made just looked a bit like slops, but there's a lovely picture of red onion too.
Brilliant.
And the certificate says, certificate to show we've done it again. Veterinary Ramblings has aced the eclectic CPD oeuvre. Didn't we do well? That's signed him and me, Mike and Julian.
There we go.
Fabulous.
So
Fabulous.
you download that certificate.
Cricket clap. Cricket clap.
Yeah, download that certificate, present that to the RCVS as certification of completing your CPD.
Well, we've had the CPD thrust at us, but we've got to reflect on it.
Oh, it's all about the reflection, Julian. It's all about the reflection.
So Joe, would you be kind enough? May I invite you to reflect upon the CPD that we have provided this evening?
Gosh, well, I mean, it's been an eclectic mix for sure. Absolutely. I mean, superb delivery from both of the hosts, obviously.
You're over-egging beyond it.
I'll have to get her back. That's brilliant. I like that.
It's very nice. It's
Yeah,
lovely. But over-egging, we're just going to reflect. So we're going to...
Yeah, just
there.
reflect.
Oh.
I'm loving the sound effects.
We've not had sound effects before on the
You're
reflection.
the first guest that's done sound effects for us. It's brilliant.
Wow.
Thank you. All good stuff.
All good stuff.
Indeed. So you're going to spoil the whole show with a joke then, Julian?
I'm going to ruin the whole thing with a joke. And,
Okay.
and we haven't had a rude joke for ages, so I thought I'd do one.
Uh-oh.
That's not my influence in any way, shape, or form.
Brace yourself, Joe.
I wanted to do something surgical, but fairly light-hearted. But I couldn't find any jokes, fortunately, about sepsis. And please don't send us any jokes in about sepsis. It'll be with the height of bad taste.
Send them to me. Yeah.
It's about this man. He goes to the doctor and he says, I don't know what's wrong, but recently I've had severe pain. It starts on my left side, about the waist level, and it goes all the way up, round by my shoulders, round the back of the neck, round my other shoulder, all the way down the other side, ends up the right-hand side, round around the waist level. It's really, really severe pain. And the doctor says, could be a number of things, he says. Let's examine you. Take your clothes off. So this guy takes his clothes off, and takes his shirt off, and takes his trousers off, and the doctor goes, whoa. Goodness me, that's very proud of that, aren't you, sir? He said, how do you mean? That's rather large, or your fellow down there. Oh, thanks very much. It's not, I think that's the problem. What do you mean? Well, I think that's the problem. I think it's the weight of that, and it's sort of pulling your whole groinal area and causing this pain. He said, you're joking. He said, no, I think that's what it is. I'll refer you to a specialist. So he sees his specialist, and the specialist says, yes, how can I help? He says, well, I've got this pain. It starts around that sort of waist level on my left-hand side. And it travels up around behind my shoulders, back of my neck. Really sharp pain. Round, goes back down to the right-hand side. And causes a real sort of twinging pain on the right-hand side. Yes, he said, yes, yeah, the doctor thinks it's penile gravitas, doesn't he? Pop your trousers down, let's have a look. So he pops your trousers down, well, goodness me. The specialist, yes, that's certainly the problem. So, well, how can I get rid of it? Because this is ruining my life. I can't, this pain, it's starting again, right around by the waist and up it goes by the shoulders. And, well, especially, we're going to have to perform a penile amputation. He said, what? Yeah, so take most of it off. There's no other way. No other way, I'm afraid, no. But my old fella, yeah, chop him off. We'll never look back, it'll be fine. So he books him in. The guy needs something. He's in such pain. So he goes in for the surgery and has it done, and he lifts the sheet up afterwards. It's almost all gone. Oh. And he's bereft, and a month later he's still feeling very depressed about all this. The pain is still there. He's wearing loose clothes, so nothing's pressing on there. But the pain's diminished a bit, but it's still there. And he goes to see a psychologist who says to him, "You've got low self-esteem because you've had this huge, great." Tallywhacker, and it's been removed, tiny little thing now. So he said, well, what do I do? Do I need antidepressants? He said, no, you just need to make yourself feel good. He said, tell you what, I'll give you the name of my tailor, Savile Row Tailor. You go to him, get a new suit. New suit? Yeah, you get a new suit, you'll feel a new man, honestly. You'll feel so wonderful. You'll wander around in the streets, and everyone will look at you and say, what a nice suit, and you'll think, well, gosh, I must be someone. It'll really help. So he goes to the tailor, and the tailor measures him up. Yep, that's all good. Yep, there we go. Inside leg, there we go. And he says, which side do you dress, sir? He said, sorry? which side do you dress? So, well, I don't know. He sort of thinks it's probably changed now, hasn't it? So, I don't. Does it matter? Oh yes, he said. If you dress on the wrong side, and an awful pain that starts off on the left and it goes right up by the back of the shoulder blades, back of the neck, all the way down to the other side.
Very good. Very good.
Oh dear, cheers.
I thought you were going to tell a rabbit joke.
Go on, tell us the rabbit joke.
What, the one about the rabbit going to the pub?
Yeah.
It's just the barman, I'll have a pint of beer and a toasty, please. The barman says, okay, well, I'll give you a pint of beer, makes him a cheese toasty. And rabbit drinks the beer, eats the toasty, goes back to the bar and says, pint of beer and a cheese toasty. The barman says, sorry, we've run out of cheese, you'll have to have a ham toasty. Okay, pint of beer and ham toasty. So gets a ham toasty, drinks the beer, eats the ham toasty, goes back up to the bar. Pint of beer, ham toasty. Oh, sorry, Mr. Rabbit, but we've run out of ham now. I can do you a tuna melt toasty or something like that. Okay, pint of beer, tuna melt toasty. Drinks the beer, eats the toasty. Last orders, please. And the rabbit goes out, trolls out to the front of the pub as if he's going to leave, and he throws up all over the front door of the pub. And the barman said, you silly Mr. Rabbit, you shouldn't have drunk all that beer. And the rabbit looks up at him and he says, it wasn't the beer, it's because I mixed in my toasties.
Oh. Oh dear. And on that note, definitely get your rabbits vaccinated.
Absolutely. Do get your rabbits vaccinated.
Have your rabbits vaccinated against myxomatosis? It's not a very pleasant disease, is it?
No, really quite awful.
I don't know. There we go. So, have you enjoyed yourself, Joe?
Fabulous. It's been really nice. Thank you. It's been great to see you guys because it feels like a very long time since catching up with you.
Thank you so much for coming on to the show tonight and sharing so much with us.
Absolutely.
No, thank you for having me.
It's been a great experience. Thank you very much, Joe. So Joe Hind, thank you very much indeed for joining us on Veterinary Ramblings. And remember, if you've enjoyed what you've heard or enjoyed what you've seen, don't forget to click like, follow, and share to all of your friends or anybody else that thinks that you may think will enjoy what we put out. And don't forget to subscribe so that we can keep doing what we do. Joe Hind, thank you very much indeed. May your dog go with you.
May your dog go with you. Thank you, Joe.
May your dog go with you.
Good night. And cut.
Thank you. So yeah, no, really good and really nice to actually do something, if that makes sense. This is week, well, I don't even know what week. 24th of September was the last time I was well. So it feels like a very long time since I've done anything, and certainly anything career related, veterinary related. So yeah, it's really nice to, even though it's just rambling on, but then again, that's kind of what I do anyway. So that's my lecture style.
and that's why we set it up, because we found that actually out of our lectures there's probably 5 minutes to take a message, if that, and the rest is rambling, which is all good fun and very much needed, I think, in the world.
I like this rambly style of just being real, I think, and just being open and honest.
Good. Well, we've enjoyed having you. Thank you so much.
Thank you.
Indeed, Joe.
Appreciate it. Thanks, guys.
Absolutely brilliant. You might need to go and get well soon, eh?
Yeah. Take care.
All right.
Take care.
Bye.
Bye-bye.
Bye. Oh, that's amazing.
Yeah.
God, what a hell of a journey, huh?
What a story.
Yeah.
What a story.